Hello, I'm Michael Cordell, President and CEO of Digivista Medivision. Diabetes mellitus is a major public health problem that is approaching epidemic proportions globally. Worldwide, it affects more than 380 million people, and the World Health Organization estimates that by 2030, that number of people living with diabetes will more than double. In this video, we will present the most recent advances in diagnosis and treatment of both type 1 and type 2 diabetes, as well as ongoing research into this complicated and deadly disease.
Diabetes affects more than 23 million Americans, nearly 8% of the United States population. More than 5 million of those affected do not know they have the disease. New cases of diabetes mellitus are expected to double by 2050, affecting as much as 21% of the U.S. population. Already considered an epidemic by public health officials, someone in the world is diagnosed with diabetes every 5 seconds. The vast majority of cases of diabetes fall into two broad etiopathogenic categories. In type 1 diabetes, the cause is an absolute deficiency of insulin secretion. Individuals at increased risk of developing this type of diabetes can often be identified by serological evidence of an autoimmune pathologic process occurring in the pancreatic islets and by genetic markers. In the other, much more prevalent category, type 2 diabetes, the cause is a combination of resistance to insulin action and an inadequate compensatory insulin secretory response. In the latter category, a degree of hyperglycemia sufficient to cause pathologic and functional changes in various target tissues, but without clinical symptoms, may be present for a long period of time before diabetes is detected. The goal of diabetes management is to maintain blood glucose levels as close to normal as safely as possible. Since diabetes may greatly increase rate for heart disease and peripheral artery disease, measures to control blood pressure and cholesterol levels are an essential part of diabetes treatment as well. Patients with diabetes generally must take responsibility for monitoring blood glucose levels, dietary management, maintaining physical activity, keeping weight and stress under control, monitoring oral medications, and, if required, insulin use via injections or pump. Physicians often note that the epidemic is driven by obesity rates, and diet and exercise trials often do not work on a long-term basis in the real world. In high-risk patients, therefore, the treatment of choice is often pharmacological therapy, optimally with combination of diet and exercise. The ACE-AACE Prediabetes Consensus Statement recommends that lipid and BP goals be the same for those with prediabetes as for those with full-blown diabetes. The experts recommend statins to achieve lipid treatment goals of 100 milligrams per deciliter for LDL, 130 milligrams per deciliter for non-HDL, and 90 milligrams per deciliter for apolipoprotein B. The vast majority of type 1 and type 2 diabetes cases are polygenic diseases, meaning that more than one gene contributes to risk of and progression to diabetes. However, there are other, more rare forms of diabetes caused by single gene mutations. These monogenic forms of diabetes only account for an estimated 1 to 5% of all cases, but scientists have identified particular single gene mutations as the causative factor in neonatal diabetes, diabetes that appears in newborns up to about 6 to 9 months of age. These individuals are often misdiagnosed as having type 1 diabetes and treated with insulin. However, because the single gene mutations don't necessarily result in total insulin deficiencies, oral medications like sulfonylureas can sometimes be used to better manage diabetes in patients with monogenic diabetes.